Good afternoon and welcome to the Lunchroom on Radio Caribbean International. It's Monday, the 6th of November 2023, and this is program number 1087 of the Lunchroom. I'm your host, Calix George Jr. In addition to FM radio, 101.1 FM, you can also get us at our website. It is rcistlucia.com, rcistlucia.com. And of course, you can always download all our previous programs off that website. And we're broadcasting live as well through our YouTube feed. And you can just go onto YouTube and search for Radio Caribbean International. Of course, be sure to subscribe to that page, please. Now, if you want to tell us what's on your plate today, the number to do so is 452-3046. Again, 452-3046. You can also call in via WhatsApp number. That is 724-0008 as well. You can message in to that WhatsApp number. Again, that number is 724-0008. Now, on our plate today, we're going to be speaking about some health care matters, in particular, the matter of prematurity. It is Prematurity Awareness Month, and we're going to be speaking to two representatives coming out of the pediatric team at the Owen King European Union OKEU Hospital in just a bit. But first, our birthday wishes for today going out to Mr. Delroy Matre. Happy birthday to you, Delroy, and wishing you an absolutely wonderful and fantastic birthday. Also celebrating his birthday today is Mr. Ken Howell. Happy birthday to you. And we do hope that you're having a good one. Mr. Miguel Trim as well is celebrating his birthday. And we're wishing you a wonderful birthday celebration, Miguel. In fact, all our birthday greetings are going to men today. Also sending some birthday greetings to Mr. Craig Prescott. Happy birthday to you, sir. And we do hope you're having a very blessed and wonderful celebration. And also birthday greetings going out to Mr. Kmar Louisi. And we do hope that you're having a splendid birthday as well. And one of our guests today is actually celebrating his anniversary. He'll tell us about that in just a bit as well. Congratulations to you. Now, a bit of history for today. In the year 1813, the Chilpancingo Congress declared Mexico independent of Spain. 1860 on this day saw the Republican Abraham Lincoln of Illinois elected as the 16th President of the United States. On this day in 1913, Mahatma Gandhi was arrested for leading Indian miners' march in South Africa. 1917 on this day, the Bolshevik Revolution began with the bombardment of the Winter Palace in Petrograd during the Russian October Revolution. Those times the calendar hadn't changed yet, so it was still October the 24th in Russia. In 1961, on this day, the United States government issued a stamp honoring the 100th birthday of James Naismith, and he was the inventor of the game of basketball. He was actually Canadian. And in 1978, on this day, the Shah of Iran, Mohammad Reza Pahlavi, placed the country under military rule. And we now move on to our dish of the day. The daily dish is brought with the kind compliments of our good friends at Tiles Plus.
One tiles for your home, I see. Bathroom, kitchen, pantry. Need tiles for your balcony. Come down to Tiles Plus, satisfaction guarantee. Tiles Plus, Tiles Plus, Tiles Plus. Big tiles with unbeatable cost. Customer service, A+. With all kind of tiles, come down to Tiles Plus. We also got gasway and vanity. Books, doors, you'll see. Come down, don't mind nobody. We got the best tiles on island. Trust me. We are located Land Street in Castries, Bosses Jugo Zile, and Slack Street in Beaufort. Telephone number 453-7939.
Serving now, the Daily Dish.
And welcome back to our program here today at the Lunchroom. Now, of course, we tend to focus on a number of different issues in terms of healthcare, and you'll be quite familiar with a lot of emphasis being placed over the years on matters of cancer, of course, breast cancer, prostate cancer, lots of awareness as well being placed on issues of lifestyle diseases, non-communicable diseases, but as well the matter of child and maternal health is also very, very significant. And no doubt about it, it is a major aspect of the work of a lot of the secondary care facilities all around the island, their role in dealing with maternal care, pediatric care, and of course the really, really important time, that of expectancy and childbirth. And one can say, as a people, we've certainly made, or as a population all around the world, we've certainly made some significant strides in terms of improvement as it comes to the matter of childbirth. At one point in time, that was a really scary time for a female. And thanks to the advancements of medicine, it certainly is far, far advanced and better off in today's world. And November the 17th is actually World Prematurity Day. And the Owen King E Hospital is marking the entire month as Prematurity Awareness Month. And we're so very pleased to have to discuss the matter today. We have two individuals from the Owen King E Hospital, Dr. Len Shillingford, as well as Nurse Elva Forrester. Welcome to the Lunchroom on Radio Caribbean International.
Thank you very much. Well,
now, first and foremost, I think most people have an idea of, the term prematurity. We've heard of preemies, we've heard of births coming early. But Dr. Shillingford, what is prematurity? I mean, how is it defined? At what point in the term does a baby come a little too early that isn't actually considered a premature birth?
So a premature baby is a baby that's born anywhere before 37 weeks. So anywhere before 36 weeks and 6 days. So any baby that's born before that time, that baby is considered to be premature.
So what's the normal period?
So normal period for babies to be born is 37 weeks to 40 weeks, 41 weeks and 6 days. So that's a term baby. Mm-hmm. Right. If a baby is born after then, that baby is considered to be post-term. But if a baby is born before 37 weeks, then that baby will be considered to be a preterm baby. However, any baby that's born before 24 weeks, we don't normally consider them to be premature. We just say that they're non-viable. So it's really between 24 and 37, 36 and 6 will be prematurity. Now, prematurity can be divided into different, based on the levels of degree of prematurity. So we have the extremely preterm babies that's born below 28 weeks. We have the very preterm that's between 28 and 32 thereabout, and then we have moderate to late pretermity that's between 32 and 36.6. So yeah, with regards to the division of prematurity, that's how we'll have it.
Now, I mean, around the world, no doubt about it, most people, of course, want to have a normal delivery. But how common is prematurity?
Actually, worldwide, it's quite common. It's the rate about the world is 13% roughly, and so worldwide would be like 15 million babies are being born yearly. That's premature. 15 million.
So 13%. So over 1 in 10.
Over 1 in 10 babies
actually
are born
coming out premature.
Yeah, and in St. Lucia, our numbers are very close. It's close to one, about 12%. They're about 12 to 13%. 13.4 they're about in St. Lucia for every 1,000 births. Right, so we have, it's relatively weak in keeping the numbers worldwide.
Now, you did mention, of course, that there are these bands of you're having to do with extreme preterm babies or moderate to late term. Are we also seeing consistency in that regard too, in terms of how they are divided?
Yes, actually, yeah. We don't have the numbers for each band, but our numbers generally of preterm prematurity, they're in keeping with what's worldwide. Yeah.
Now, of course, dealing with, in fact, before we actually get to the issue of how you care for prematurities and, of course, the complications dealing with of the births and what have you. But what are the leading causes of prematurity?
Okay. So most times the cause is not known. Most times why baby is born premature, a lot of times it's not known. However, there are a lot of factors that can influence premature birth. One of which would say is the lack of poor antenatal care for the mother during pregnancy. A lot of parents when they're pregnant, or mothers when during pregnancy, they don't do their follow-ups. That's one of the things that could lead to premature deliveries.
So, and just to break it down very simply for some of the listeners, when you say antenatal or postnatal, you mean, yeah.
So antenatal care, that's what happens. That's what mommy is supposed to do during pregnancy. Go to the health center, get checked, get regular checks at the health center. Or
While she's expecting.
While she's expecting. From the time that she knows that she's pregnant, she's supposed to be seeing a healthcare provider that helps to guide what is to be done, the blood tests, etc., etc., etc. Because during that time, things can be happening. Ultrasounds are needed, and they guide as to what should be done and what to expect during the pregnancy and even at birth.
So, of course, regular checks. How regular should that be?
So different. It depends on the mother and the type of, what I said, the situation. Normally, I think they do like once a month checks initially, then
In the
early stages of
you would
pregnancy.
have, you go to your clinics every week, every 2 weeks, and it progresses. Again, it depends on the condition of the mother. So that's why we're saying that you go to your doctor as soon as you know that you're pregnant, so then they could make the necessary steps and as to guide you as to when to come to the clinics and stuff like that.
Yeah.
Now, I suppose first-time mothers would be very eager to go to these clinics, but do you see that maybe persons who are having a second child, third child, that they're a little less consistent, or do you see that they, I mean, what's the attitude? Does it vary?
It does actually. Sometimes, a lot of times, okay, so there are two ways it happens. Sometimes the first-time mothers, they don't know. They don't know, so sometimes the antenatal care is lacking a bit. But then some of them, they're very anxious, and so they go very often. And then a lot of times you find those who have been through it a few times, they kind of feel like they know what to do.
They know it all already.
So they don't do the frequent visit. But then there are those as well who know what to do, so they do what they know they're supposed to do. But yeah, it happened both ways. But that's just one of the factors that influence premature delivery. Things like smoking during pregnancy, drinking, infections during pregnancy. There are those mothers who've had previous premature deliveries. They are at risk of having another one. There are those who've had multiple losses during pregnancy. They as well at risk of having another premature delivery. Am I missing anything else? Yeah. But as I said, mainly, usually the cause is not always known. Usually it's not always known, but we have a baby in front of us that we have to take care of.
So let's say, for instance, the mother may have had a miscarriage or two before,
Prior.
and she's currently expecting.
She's at risk.
She's at risk, and she needs to be
Seen,
especially cautious about. Okay.
Regularly. Yeah.
Did we mention infections? If
And what kind of infections are we speaking about?
Vaginal infections, say like urinary tract infections, if they're not treated, then they're predisposed to having a preterm baby. Also, if that mother has health issues, such as complications in pregnancy like preeclampsia or heart disease or kidney disease, they too are prone to that.
Yeah.
Now, when we say preeclampsia, what are we speaking about here? Just for those who may not be, again, the new mothers or those.
Okay, so preeclampsia, short form is during pregnancy. There's a lot of times women become hypertensive just during pregnancy. So a normal mother, a normal young lady, she's not, it's not hypertensive, but during pregnancy she becomes hypertensive. Now, sometimes that hypertension comes with some signs, with some different complications, protein in the urine, swellings, and these sometimes cause complications. When you group these complications together, we can call them preeclampsia, and if it even gets to a point where there's seizures, then we call it eclampsia. These are things that cause babies to be born premature, and sometimes it leaves us, the doctors, to make the decision to deliver baby to save mommy, because the preeclampsia and the eclampsia can cause some harm to mommy, and sometimes you need to deliver baby to help mommy. Yeah.
Yes, it's certainly very, very important there, because we've seen in the past the issue of maternal deaths, mortality as a result of delivery. And now, I mean, some of the things that you mentioned, of course, are pretty well known to everybody in any case in terms of the matter of use of drugs or use of alcohol or smoking. Those are things that definitely any mother should be stay away from and avoid. Now, are there any medications or any other things that might potentially cause prematurity?
Medication.
Anything that some people should be keep away of, or foods, or things that, you have a lot of old wives' tales, and people may be thinking that there may be certain things that may impact their pregnancy.
Not food as such, with regards to, I mean, you need to eat healthy. For the most part, you need to eat healthy. So, but from what I can think, from the top of my head, I can't think of any foods in particular that would provoke a premature delivery.
Okay, so there's no association with diet.
Not that I'm aware of,
okay.
Right, no, directly. Yeah.
Okay, wonderful.
Yeah.
Now, in terms of symptoms, are there any signs that we can look at that may suggest that we may be dealing with a potential premature birth?
Sure. The difference with a premature baby as opposed to a full-term baby, the weight for one is really lower than the full-term baby. You see babies with birth weight from 1.1 pound to 4.4 pounds. The skin is thinner. They lack that fat. They have a head that appears or looks bigger than their body. The skin also the thin skin is shiny and it peels easily. They have veins that's visible through their skin, and because of that, they too are predisposed to more complications.
Now, just another question too regarding this matter of risks. Are persons who are expecting twins or multiple babies, are they more at risk of having premature babies?
Actually, yes, because usually you try to deliver multiple gravid person prior to someone who just has a single baby, because I mean it's just a lot more stress on mommy. So a lot of times they are at a greater risk of prematurity, the multiple gravid mothers. So you have twins and triplets. Usually they're delivered before a singleton or a mother who just has one baby inside of her. Yeah.
A woman who's, like you said, is at about maybe week 30, week 35, not expecting to deliver. And, I mean, would she get any hints beforehand? What should she be looking at in terms of her body at that point? In terms of letting her know that she is going to be going into labor early, is there any sign at all?
Well, there could be, she could start feeling contractions earlier than she should be. And these contractions getting a lot stronger when they shouldn't be getting so much stronger. She could have a water bag breaking before the time. She could lose her mucus plug. All of these are things that maybe tell you, hey, you're going into preterm delivery or premature birth. So, these are some of the things that she may experience and may tell her that, hey, something is happening before it should be happening.
So definitely in terms of what we're saying for trying to ensure that we prevent premature births, avoiding things like alcohol, smoking. You said good healthy diet as
Yeah.
well. Being a very critical one.
Keep
Keeping
your
your
prenatal
appointments and
appointments.
keeping
Yes.
your checks.
Being positive, having a general positive outlook.
Now speak to that a little bit in terms of why is that important?
Well,
Being positive.
Generally in life, it's just better to be positive, generally speaking.
Right.
But then it helps you. It's more than just physically. A lot is not controlled, but affected by your outlook on life. And just being positive helps you, generally speaking.
And I suppose you're speaking towards a matter of mental health and
Mental
wellness
health and your psyche and
dealing
all of
with
that.
stress. Is
Dealing
stress
with stress as well. Yeah, all of this. And then your family support is important. Yeah, that type of stuff. Because it definitely helps, not just prior to delivery, but even after as well. Because, I mean, things do happen. And as we'll speak about a little later, preterm babies, they do go through a bit. They do go through a bit. And the parents as well go through quite a bit. So a positive outlook will definitely help in that process. Yeah.
Now, a mother comes in early, delivers a preterm baby. What happens next? What is the care like at Owen King E Hospital? What should the mother expect at this point?
All right. So it all depends on the level of prematurity. Right? Every baby is different, but it all depends on the level of prematurity. Most of these babies will be admitted to the special care baby unit. That's where we deal with the very sick babies. Right? Most of them will be admitted in there, and parents will come in there to view and to see and get updates from the doctors and the nurses. Most of them, they will have difficulty breathing, for which reason we will give them some level of support depending on how far back they are. So if they're doing quite well, the amount of support we give will be minimal. But if they're very premature and they have a lot of difficulty breathing, they pretty much cannot breathe on their own, then we have to pretty much breathe for them. So we would put a tube down through their mouth into their lung and attach them to a ventilator or life support machine, and we'll be breathing for them. These babies will be in an isolate. That's where we keep them incubator.
Yes,
Yeah,
incubator.
an incubator that helps to maintain their temperature. These babies will be given antibiotics because usually being preterm means that you're at risk of infection because the bodies are not the immune system is not developed. So we will give antibiotics that will help them to fight infection. They will get fluids because they will not be able to feed. So we have to give them fluid through a vein. And most of the times with the very small baby, that vein it's a line that we put into the navel that delivers all fluids, whether it's medication or just sugar and salt and protein that they need. That line will deliver all of that into them. These babies will get other medications that are going to help them to breathe. Now, there something that we all should know, mothers should know, is babies that are born very premature, because of their difficulty breathing, especially those that are born before 32 weeks of life, they would need a medication that's very expensive, and that the parents have to provide for babies. Right? It's something called surfactant or Survanta that costs. Usually, every baby, the babies that are premature, they may need one vial, and that vial usually costs $2,550. Now,
EC dollars.
EC dollars, right? It's a big cost for anybody to deal with, just knowing one time. So this is why these shows are important, to educate the public and let them know that that's a possibility that you need to keep in mind when pregnant, because during pregnancy no one knows who exactly is going to deliver preterm. So these things you need to bear in mind of the possibility. So you maybe need to pocket that money somewhere in the event that you may need that money to provide the surfactant for baby. Anything. Babies are premature, they may get yellow which is normal for most
Jaundice,
babies,
yeah.
jaundice. So babies may get jaundice. And if we see jaundice, we're going to give them the light that helps to bring down the jaundice. So we normally put them on the blue light, or we call it phototherapy. And whatever we see baby may be needing at the time, we'll provide. But mainly, I think I covered most of the things.
In terms of eating, how is that baby going
Right.
to be supported?
Again, it depends on babies, how premature baby is. So the very, very premature one, they will not be able to eat not until a decent time after.
We see that the need baby has developed, the lungs have developed, the organs have developed, and baby shows a sign that they're well. We use the tube to feed at the time they're critically ill, and as they develop, as the organs develop again, that's gradual. So babies show us that they're ready to suck, they have that suck-swallow reflex, then we start to do by the mouth. We feed them by the mouth.
Now, help us understand, especially for the mothers now, I mean, because, there's expectation that, you've given birth and you want to be able to hold your baby and feed and all of that and bond. That's not possible for a little while. Tell us about how long that's going to be. How long would one expect?
Every baby is different, but generally we encourage the parents to come in as soon as your baby is admitted to the NICU, the neonatal intensive care unit. We encourage them to come in because we are working with them to allow them to bond with their babies. At first, bonding may not take place because they're critically ill and they need that support. Their lungs are undeveloped and they need that support. They're probably on the ventilator. So we ask them to come in. They come in for updates. We ask them to come in, express their breast milk, and it can be stored in the fridge under clean conditions because, again, babies probably, they're very critical and they cannot gain that bonding time as yet. So as soon as baby shows signs of development, getting better, we encourage them to come. We encourage them to take part in nappy change, take temperature for baby, get fully involved. And we are there as nurses and doctors to support them.
Wonderful. Now, we have been speaking on the matter of prematurity. It is Prematurity Awareness Month. It's November, and we've been speaking to two representatives of the OKEU, Owen King EU Hospital's pediatric team, Dr. Len Shillingford, as well as Nurse Elva Forrester, about this entire matter. But we're due to take in our weather report, so we're going to do that right now and then come back to continue this conversation. Very, very important conversation on the matter of prematurity.
This has been The Daily Dish.
One tiles for your home, I see. Bathroom, kitchen, pantry. Need tiles for your balcony. Come down to Tiles Plus, satisfaction guarantee. Tiles Plus, Tiles Plus, Tiles Plus. Big tiles with unbeatable cost. Customer service, A+. With all kind of tiles, come down to Tiles Plus. We also got gasway and vanity. Books, doors, you'll see. Come down to mind nobody. We got the best tiles on island. Trust me. We are located Land Street Industries, Bosses Joe Grizzly, and Slack Street in Dufort. Telephone number 453-7939.
Make your home merry and bright with Island Style's massive Christmas sale. Our wide range of porcelain and ceramic tiles are on sale up to 50% off. And that's not all. Save up to 15% off. Bathrooms with bundle and save. The more you buy, the more you save. On gorgeous bathroom vanity, bathtubs, faucets, shower glass, toilets, and more. Plus, contractors and tilers are in for a treat with our special discounts on tiling tools and accessories. Sale on now at all locations: Castries, Rodney Bay, and Viewfort. Or call 450-452 or 453 Tile. It's time to deck the halls, deck the walls, or even deck the deck with huge Christmas savings only at Island Style.
This is Radio Caribbean International. It's now time for the weather news.
So of course, on 1.1, it's now time for your weather report as of 12 noon today, presented by Island Style. Tell them about. The forecast for St. Lucia Valley for the next 24 hours. Winds will be blowing from between the east and east-southeast near 50 miles per hour or 24 kilometers per hour. The weather partly cloudy to cloudy at times with scattered showers and a chance of isolated thunderstorms. The forecast for Lesser Antilles. Partly cloudy to cloudy at times with scattered showers and a chance of isolated thunderstorms. And the tropical weather outlook. Moisture and instability associated with a weak trough system will generate a few cloudy periods with showers and possibly isolated thunderstorms over the Lesser Antilles during the next 24 hours. Tropical cyclone formation is not expected in the tropical Atlantic during the next 7 days. And this was the weather report as of 12 noon today, presented by Island Style Bath.
This has been RCI's Weather News. For more information, call the Weather Hotline at 454-3452. RCI 101 number 1.
Make your home merry and bright with Island Style's massive Christmas sale. Our wide range of porcelain and ceramic tiles are on sale up to 50% off. And that's not all. Save up to 15% off. Bathrooms with bundle and save. The more you buy, the more you save. On gorgeous bathroom vanities, bathtubs, faucets, shower glass, toilets, and more. Plus, contractors and tilers are in for a treat with our special discounts on tiling tools and accessories. Sale on now at all locations. Castries, Rodney Bay, and Viewfort. Or call 450-452 or 453 Tile. It's time to deck the halls, deck the walls, or even deck the deck with huge Christmas savings only at Island Style.
And welcome back to our lunchroom here at Radio Caribbean International. And we were discussing prematurity, preterm births. And we're doing so with Dr. Len Shillingford and Nurse Elva Forrester of the Owen King EU Hospital. I do notice that the OKEU has been reaching out quite a bit recently in terms of consulting and engaging the public, and so definitely kudos to OKEU. And we're speaking about the really important matter in terms of maternal and childcare, that of premature births. And we have been speaking about the lead up to it, what could cause it, the issues that we need to watch out for, and of course, now at the point where the baby has been delivered. We didn't really ask the question though as to, do you end up having babies that just simply won't be able to make it in a lot of instances? How common is that?
Yes, we do actually. As I was mentioning earlier, there's the aspect of the baby's gestational age. So normally babies that are less than 25,
24, is that it?
24 weeks, we normally consider them as non-viable. Non-viable meaning that the chances of them surviving are extremely low. So we normally would not go on to support that baby. However, there's also the aspect of the baby's weight. Mm-hmm. So babies that are less than 700 grams, we may not necessarily support that baby. However, I can say that in St. Lucia, we've been able to successfully ventilate and treat and care for and manage a child that was born at 540 grams. I think that's like 1.1 pounds, just a little more than a pound of rice. And 26 weeks. 26 weeks gestation. And that child is maybe about 7 years old.
7 years old.
Right now.
Well, past kindergarten.
Yeah. So we've been, but we do see the ones that are born that we can do much for.
Is it fair to say that those are rarer though? I mean, when they come in those extremely preterm cases.
They are more rare, and no one wants to hear that you can't do anything for my child. Mm-hmm. No one wants to hear that, and so that's a difficulty that we have to face in bringing that news to mommy or to daddy. That hey, we're sorry to tell you that there's nothing much that we can do right now. And then there are those that fall within the criteria for us giving support, and because of all the risks in prematurity, then we sometimes they don't make it because it's just too much. So there's also that, because prematurity on its whole, on the whole, it comes with a lot of difficulty and challenges, a lot of challenges. So yeah.
Mhm. But of course, I suppose the positive outlook that you mentioned is really important at that point
Definitely.
for the mother, in particular, parents.
Definitely. Definitely.
Now, the matter of capacity, and of course, you mentioned Nurse Forrester, the NICU with OKEU. I mean, how capable is OKEU to handle premature births at this point?
Okay, currently at the NICU, we could house 10 babies. Our intensive neonatal care can house 4. If the needs be that we put in the middle room, we do, because we've had, say, 5 critical, 6 criticals at a time.
Mhm.
But our issue is that, yes, apart from the ventilator, we have other machines as, say, those who do not require invasive, those who could do something for themselves, say they just need some support. But as to ventilators, we do have like 1, 2, 3, 4.
We have 2 markets. We have 2, 3,
Yeah, 3 markets.
3 markets, and we'll see what markets are in a while. We have 3 markets and 2 Hamilton, and
But that too, it's being shared.
right. So though we have the space to house 10,
10 infants
we have
at
the
a time.
space to house 10 infants. However, the equipment to support respiration is what we struggle with, because our numbers sometimes surpass the equipment that we have, and that itself can pose its own set of challenges.
Right.
Sometimes we have to share our ventilators with the ICU, big ICU for children, and even sometimes some of them can be used for adults. So that itself creates its own set of problems.
Right.
Yeah.
And how long? I mean, I know you said, of course, it varies, but
Mm.
on average, how long would a baby, preterm baby, be staying
Staying
on
on a ventilator.
on a ventilator?
As you rightfully said, it varies, but we try to see if they can come off by 2 weeks, by at least 2 weeks. Sometimes it's more, sometimes it's less, but every day that we come to work, we try to see if we can get that baby off the ventilator, the life support machine, because every extra day that you spend on that machine, apart from the cost that's attached, but it increases the chances of complications, of ventilator-associated infections. So every day that we come to work, the goal is to try to see what we could do to get that baby off the ventilator, meaning that to lower the amount of support that we give that baby. But we can't say exactly how much time the baby will spend on the ventilator.
So, and I think you did mention this a little earlier, Nurse Forrester, that yes, the baby is going into this care, specialized care, but the mother still has a really important role to play during that period of time, which may very well go on for weeks, maybe even a couple months.
Months.
As well,
Yeah.
yes. So again, that's why we encourage. Yes, it may be a scary experience for the parents. Yes, I delivered a premature baby, and yes, I was hoping to have a full-term baby, but the support that we give and the encouragement that we give to the parents is all in the betterment for both baby and mother. So again, we encourage. That's why we ask them if they could come in daily. That would be perfect. But then again, a day, if they choose to come, say a day in, a day out, again, it's all in the effort to encourage them to come in, that bonding, and again, it helps the preterm baby to grow, we do with them, the mothers and the baby's kangaroo care, which plays a very important part in the baby's development.
Now, what exactly is that? Because I mean, it's going to have some.
Just to break it down, this is where we place the baby in the mother's, between the mother's breast or on the mother's chest. That kind of bonding, it gives the mother a sense of, okay, I've delivered, I could hold my baby as much as the baby is small or preterm. It encourages skin-to-skin contact. It encourages temperature regulation for the baby. Again, it helps the baby become better.
Now, Dr. Shillingford, beyond that, let's say, for instance, the baby has now gone through that period, has gotten off a ventilator, is getting that bonding, is growing, and it's now a point for discharge, and that can actually leave with mommy and daddy to head home. Are there special guidances that mothers and parents need to abide by, or things that they need to take in consideration in taking care of a preemie?
Well, definitely parents should know, or we would advise or inform them that there are some things that they should know about their premature baby as baby develops. For one, baby being premature, baby may seem a bit slower than a baby who's born at full term. So whereas a baby is born at 40 weeks, there's some things that you will see at 2 months and something you see at 6 months, something you see at a year. For a baby that's born premature, that will definitely most times be a bit pulled back. There are babies that are premature at risk of things like seizures. Again, because of them being premature and being born too early, these things, though they may not, even if they don't happen while they're admitted, but there's a possibility that after, in the long run, they may be able to see seizures. Some of the babies, because of the rough times that they endure through that duration in our care, they may grow up to have less functions than a normal baby. So some of them will have cerebral palsy. That's a very common, very, very common complication, or a long-term complication that we see with our very premature babies. Parents should ensure that they follow up at the local health center and with us, so that the vaccination schedules are followed, because there may be some adjustments that are to be made with the vaccination schedules for the premature babies when they are being discharged. Anything I'm missing? There may be some learning disabilities, again, being premature because of all the rough time, the roller coaster ride that they would have gone through during the admission under our care, because of the some of them may have some, brain insult during that time because of oxygen levels not being where it's supposed to be and all of. So these are things that parents have to look for when, as the premature baby grows. And what we normally do is, upon discharge, we ensure that we refer these babies to a center in La Clery called the Child Guidance and Development Center, that's the CDGC. They follow up with these premature babies as they grow, because being out of the hospital, they will be the ones that usually identify some of these learning disabilities, some of these impairments that these babies have. Visual, hearing. We ask them to see eye specialists and someone to assess the hearing, because all of these things can be affected during that time when they are premature under our care. Yeah.
But then I sometimes you hear anecdotally that premature babies end up being stronger when they grow up, that they they seem to be because of whatever the challenges they've gone through in the younger periods of life, they end up being very successful. I mean, this may be obviously anecdotal. I don't know.
Yeah, I'm not sure with science, but it's maybe true. It's difficult to say.
Right, of course. And of course, beyond the matter of, I mean, you mentioned the issue of learning disabilities, the seizures. I mean, what's causing that exactly? Do you have any ideas to?
Okay, so sometimes these babies, when they're born, there may be some time during just after birth that their brain does not get the level of oxygen that it should get, right? What that does, it causes some brain injury. Now, brain injury some can have permanent scarring, permanent effects. That though right now you don't see the effects of it, but as the baby may grow up, there may be some at some point that there is manifested effects of the brain injury that the baby or underwent during that time. So that may cause some seizures. It may cause seizures. It's not a will, it just might happen.
Right. And these things that you're mentioning, of course, in terms of long term of issues of maybe visual issues or seizures, how common is it really in terms of premature babies?
Of the ones that we've seen, I would say the more common one would be the seizures. We don't get a lot of babies who are visually impaired or hearing impaired, but what we may get premature babies who end up having seizures at some point. Though it's not all babies, definitely, but of these complications, these are the ones that we may see more. That's the one that we may see more in the complications that we know of.
And when you're looking at these matters, you're speaking about those who are moderately termed, or are you looking at just
usually those that are very extremely preterm?
extreme?
Yeah, so
Okay.
below 28 weeks. Yeah.
Now, let's speak about the mother a little bit in terms of what happens to her delivering preterm. Are there any things that she should be watching out for in terms of? I mean, I know there is an issue of postpartum depression. Is she more likely to experience depression? Are there certain things that she should, watch out for?
Okay. With the mothers after they have delivered, again, that support system, that's where we encourage a support system. As much as they have that preterm baby, yes, it's a lot for them. Yes, they delivered, they have a baby, but again, who's to say that a lot is going through their minds? My baby is not well, my baby has to stay at the hospital, I gave birth, I cannot go home with my baby. At our institution, like we said, we work closely with the mothers, and again, we can detect a mother that we see that is going into depression, a mother that, okay, we're asking, Mommy, is everything okay? Do you need help? We can refer to the counselors that we have.
So there is, in fact, a system of support
Yes.
that they can get and tap into at OKEU.
Yes.
In addition, there's an initiative that was recently brought up. It's the
Primigro,
the what's the name of the group?
Tiny.
We have a WhatsApp group.
Okay.
That
Tiny people?
tiny people.
Yes.
So we have a WhatsApp group of a lot of the mothers.
So the mothers of
so they
premature
all,
babies.
they in there.
Okay.
They one supports the other.
Okay.
It helps. It definitely helps because it's a rough road after they have left. Rough road while being there, and also after they would have left, and the support that they get from each other is tremendous, because there are those that are doing better than the other, and it helps them. Helps them. Pictures of what the baby then look like and know who they have. It definitely helps.
Right, so that they can actually see some progress and they
Yep,
can share with.
To encourage them to keep that fight on, to don't give up. Yeah.
Wonderful, wonderful. Now, we have been discussing, of course, the matter of prematurity, preterm babies here at the lunchroom with Dr. Len Shillingford and Nurse Elva Forrester of the OKEU. It is Prematurity Awareness Month, this month of November, and the day itself, November the 17th as well. Now, are there any particular events coming up or things to look for in terms of what the OKEU is doing or Ministry of Health?
So before talking about the event that we have, let me just say that the theme for this year for our Prematurity Awareness Month is small actions, big impact. Immediate skin to skin care for every baby everywhere. It's kind of wordy, but that's what it is. Okay, small actions, big impact. Immediate skin to skin care for every baby everywhere. So this month we'll be pushing this year. What we have carded that we on the 26th of November we're trying to have a prematurity awareness walk that is to be held from 6 a.m. to about 11 a.m. Starting point will be the Darren Sammy Cricket Grounds to Pigeon Island. So we would encourage people to come out to support the the awareness of prematurity or the mothers and the children who have gone through that struggle. Yeah, you could register with us. It's $25 for adults and $12, I think, or $10 for children below the age of 12.
Wonderful. And just another question before we come to a close, though. You quite often hear that, and we've had a lot of conversations about bumpy roads and going on certain rides or, experiences. Is there any truth to that in terms of, could a baby come early as a result of going on a rough road or something of the sort?
Yes.
Yes. Okay.
Yes. So we would want people to avoid, and even the excess labor, excess hard working.
Right.
You want to during that time. You want to ease off the strenuous work that you may do, strenuous exercises. The bumpy roads definitely can, because it's applying excess pressure on that closed cervix, and it can provoke or induce early delivery. So you want to maybe avoid those.
So the idea of going on hikes or off-roading experiences, that's something you should
hikes, off-roading, definitely try to avoid. Hikes, I don't know, walking maybe is okay, because I guess you can cushion what you do, but maybe the rough hikes, maybe you want to take a pause on that.
Indeed. Any more advice to expectant mothers, individuals who may be listening to this program and may be thinking, boy, these people are giving me more stress than hope, What should you tell these mothers?
Stay close to your clinic, to your healthcare provider.
First and foremost.
First and foremost, yeah. You don't want to be missing your visits, because that's where a lot of things are picked up. And your questions will be definitely answered there. And anything that you may need should be given there, and you should get that from there. So do your follow-ups. Keep to your follow-ups. Ensure that you maintain a positive diet, a healthy diet. If you're on any medication, you want to ensure that you comply to your medication, and stay positive.
Yeah. Oh, wonderful. Yeah. Now, as well, I'm also thinking that when we're speaking about the issue of preterm birth, a lot of times the mothers themselves may have also been going through a lot of other stuff, because, as you mentioned, they may have had preeclampsia. It may very well be a C-section that they may have delivered by as well.
Be a C-section, yeah.
So they have their health concerns at that point as well that they need to guard against.
Definitely.
I don't know if you want to speak to that issue at all. Is there anything in terms of C-sections, how quickly they can get back to doing certain activities?
Well, we wouldn't know too much about this
okay.
after the C-sections, because that would more be on the obstetric gynecologic aspect of it. We deal more with the babies, but as a whole, as a general, after C-section, there definitely is a time frame that you would not be able to return to normal physical activity. So you definitely need time for your wound to heal before you return to normal activity. You need to not stress yourself or strain yourself too much after that time, because, you need to, allow yourself to heal.
Oh, wonderful. So it has been quite an interesting program. I think you guys were hoping to just maybe spend a couple minutes, and we've been here for the entire hour. Thank you so very much, Dr. Len Shillingford, as well as Nurse Elva Forrester of the pediatric team of the Owen King EU Hospital. It is Prematurity Awareness Month here in St. Lucia and around the world. And of course, you have that walk coming up on the 26th. Hope individuals can participate in that and keep aware. And of course, keep close to your healthcare provider, as you of course mentioned. No doubt, OKE provides a lot of outpatient services as well, and clinics to be able to support that. And I know there's been an initiative through the Ministry of Health as well, the in terms of universal healthcare and providing certain services for mothers as well.
That they make use of that. Yep.
So definitely hope that they can make use of those services, and don't be afraid of going and asking questions.
Right.
Indeed. Thanks very much. And of course, to all our listeners, do have yourself a very wonderful day. We'll be back again tomorrow, God willing, for another program here of the Lunchroom at Radio Caribbean International.